Have you ever felt the sudden and strong need to sleep, accompanied by irrepressible desires and changes in mood and behavior? Imagine feeling like you're trapped in a perpetual state of drowsiness, unable to fully engage with the world around you. Now, what if I told you that this isn't just a scene from a surreal nightmare, but a rare neurological condition known as Kleine-Levin syndrome, KLS, sometimes called Sleeping Beauty syndrome, is a rare condition that mostly affects teenage boys. It is marked by frequent episodes of hypersomnia, hyperphagia, cognitive problems, and being too sexual. We are reporting the case of a middle-aged woman who was diagnosed with KLS 16 years later than she should have been. She has had a poor response to most psychotropic drugs, but a good response to a combination of lithium, sertraline, and modafinil for the last 12 months. We are also looking at other female cases of KLS reported from India. Mrs. X, a 43-year-old married woman who worked as a housewife and had completed 8th grade, came to our outpatient psychiatric center in November 2014 with trouble sleeping, body aches, fatigue, and mood swings. Her husband said that she felt drawn towards her bed and reluctant to get up in the morning. Even though the patient was still awake, he or she became angry and hostile when they couldn't sleep. She had to sleep so badly that she was once discovered asleep on the floor near the bathroom. She used to sleep 22 hours a day because she couldn't stay awake. When she was awake, she seemed uninterested, sad, and barely interacting with other people. Her words would stay slurred and low-pitched, and sometimes it would be impossible to understand. During the episode, her daily routines, including housework, eating, personal care, and relationships with other people, were greatly affected. For example, she would demand spicy foods like kachori, namkeen, and certain veggies, which was not like her before the episode. According to a detailed analysis of the illness's symptoms and course, she started sleeping for 22 hours for the first time when she was 27 years old, after the birth of her daughter, her second child, in 1998. This made it hard for her to do daily tasks and interact with other people. The overall length of her illness was 16 years, and it showed up in episodes that were similar to those described above. Each attack lasts between 2 and 15 days, and there are full remissions every 15 days to 4 months in between. The general systemic and brain exams she had were not noteworthy. The standard range for her biochemical and endocrine parameters was met. It was discovered that the electrocardiogram, the electroencephalography, EEG, the magnetic resonance imaging, MRI, of the brain, and the magnetic resonance angiography were all fine. The patient did not want to be part of the polysomnography. The first time she saw a psychiatrist in November 2014, she was diagnosed with KLS based on the criteria set by the International Classification of Sleep Disorders. This was done after ruling out other possible causes of her insomnia, such as idiopathic hypersomnia, IH, menstrual-related hypersomnia, narcolepsy, Kluver-Bucy syndrome, hypersomnia caused by a medical condition, and hypersomnia caused by drugs or substances. As with differential diagnoses, IH is another disease that starts in adolescence and causes people to sleep more during the day and become sleep drunk. The fact that the symptoms came and went and that the person also had hypersomnia ruled out IH in this case. Period-related hypersomnia was ruled out because our patient didn't have episodes during her period, and the episodes lasted more than a week. Narcolepsy was ruled out because the index case did not have hypnagogic or hypnopompic hallucinations or sleep paralysis, which are 2 necessary factors. Kluver-Bucy syndrome was ruled out because the person did not have hyperorality or eye agnosia. MRI brain tests showed that there were no structural problems in the brain or hypothalamus. It's important to note that the patient was diagnosed 16 years after she first showed up because she had low mood, body aches, tiredness, and trouble sleeping. At other centers, she was diagnosed with depression or conversion disorder. People with atypical sadness may also have trouble sleeping and eating too much. Because the disease can look like and share many traits with mental disorders, it took longer to diagnose KLS. Periodic behavior and poor response to antidepressants, antipsychotics, and anxiety medications made us doubt the earlier diagnoses at our first meeting. At first, taking a 400 milligrams tablet of lithium carbonate twice a day during her follow-up at our center helped her feel better. The amount of lithium carbonate was slowly increased to 900 milligrams and then 1,200 milligrams. Serum lithium level was 0.61 and 0.73 mmol/L respectively because of the frequent insomnia. She got a lot better, but she started to shake and feel weak, so her lithium dose was lowered to 900 milligrams per day. But because of the return of hypersomnia, we added the 100 milligrams pill modafinil. The patient said that the length and number of hypersomnolence events were getting better. After that, a tablet of sertraline 100 milligrams was added for tiredness, less social contact, and mood swings. She has been doing well for the past year, with only 5 or 6 shorter episodes of hypersomnia lasting 12 to 24 hours. Because KLS is so rare, especially in women, there are a lot of wrong diagnoses, like the 16-year wait in the reference case. 85% of KLS patients only have one of the first 3 symptoms: insomnia, eating too much, or being too sexual. This means that only insomnia is needed. The reference patient wrote about atypical hypersomnia and other symptoms, but not about eating too much or being too sexual. There are many helpful psychotropic drugs, but lithium is the one that is most often used as a protective drug. Lithium treatment also made index patients better. There were a lot of KLS cases in the 2000s and before. Half of the cases began with fever, while the other half began with postpartum psychosis, family problems, or stress. From 3 to 25 days, there was somnolence. About 75% of the patients had excessive hunger, and 50% had sexual disinhibition. Other signs included confusion, changes in behavior, talking about things that didn't matter, apathy, derealization, and problems with perception. None of the 8 people had a history of a similar sickness in their family. One patient had an abnormal EEG and another had an abnormal CT scan. All the other patients had normal standard tests and imaging scans. 8 people got better with or without treatment. The others got lithium, modafinil, armodafinil, oxcarbazepine, or methylamphetamine. Like other cases, the reference patient had episodes of hypersomnolence that lasted 2 to 15 days. Like Mudgal et al., the reference patients had KLS after giving birth when they were 27 years old. 8. Compared to female cases from India, index patients had difficult presentations. They started having KLS when they were 27 years old, they had regular hypersomnolence for 16 years, and they tried many psychotropics but didn't fully recover. Even though she wasn't hypersexual, she liked hot food during episodes. Arnulf et al. Looked at 186 KLS cases and found that women had a longer disease course. Episodes that happened at the same age, lasted the same amount of time, and were less sexually hyperactive than men. We also found that index cases had been sick for 16 years, while male cases from India had been sick for 1 to 4 years. Index cases got KLS at age 26, while documented male cases began between the ages of 7 and 24. In the end, KLS is a brain disorder that often has mental effects, so based on how much they understand, how useful it is, and the most noticeable symptoms they have, patients may go to a neurologist, a doctor, or a psychiatrist for help. And because of this, doctors need to be very suspicious of these strange cases. Any case involving repeated episodes of being too sleepy should be properly evaluated using a multidisciplinary method to ensure a quick diagnosis and the right treatment. Now subscribe to my channel Bizarre Enigma Stories and find the secrets that are too hard to understand.